To do a number of development activities. One is to kickstart the completion of the casualty wing at our Loitoktok sub-county hospital, and just to tell the residents of Kajiado, our hospital is okay, it's doing well. We just need to support the hospital, but more importantly, we have a cholera outbreak. We have 2 cases which we are managing at the facility. The source is from Nairobi. It's a mother and a daughter. But I want to report for the records that they are in they are in a stable condition. Our officers are taking care of them. They have been isolated, and we are prepared to handle this outbreak. We have handled it before. We have what it takes to handle such outbreaks. We have the reagents, the medical equipment, and a lot of health education is currently being done in our sub-county and of course all over across our county. And we just want to urge members of the public that they need to observe hygiene related issues, basic things like hand washing after visiting washrooms. The basic thing is the hygiene and the kind of diet they eat. People need to live in a clean environment. So we just want to tell our people across the county, and specifically in Loitoktok or Kajiado South sub-county, that we have a cholera outbreak in this area, and we will keep an eye just to monitor how the situation is. But so far, we have 2 patients that have been admitted in Loitoktok sub-county hospital, a mother and a daughter. I have indicated that the source is from Nairobi, and we are also keeping a trace of the contact tracing to see that the disease will not spread. But more importantly, there is no cause for alarm. The patients are in stable conditions, and we have all the reagents and all the kits that are needed for this assignment to happen. Health education that is going on will continue going on to sensitize public on how to carry out themselves during this period. And even as people prepare for the festive season, they need just to ensure that where they live, what surrounds them, what they drink, what they eat is hygiene and clean environment. Thank you very much.
I said a lot about cholera. What I can tell our people, that let us in churches, in public barazas, let us talk about cholera. Let us campaign for it, because it's still at the initial stage. But if you keep silent and quiet, this is might come and affect us in long run. What I've seen, and Waziri has shown me through even the medicine that they have and equipment, they are ready to do and to control and try to do whatever possible to save the people from cholera, the outbreak of cholera. But now, I also want to ask the donors and the stakeholders to come out and support Waziri for what he's doing now. And I mean from the ministry. I'm aware when COVID came, when the outbreak of malaria comes, there are always stakeholders who come on board and help. Now Kajiado, because it's part of Kajiado South, is suffering now cholera, among the other parts of the country. Let us have some resources allocated to us on an emergency kits that you people and donors and our stakeholders have. We are really crying and pleading for you to help our Waziri in doing that. The county is doing much, but also need to give more, because more is needed. On the issue of drought,